After a heart failure episode, following doctor's orders is crucial. So why do some older patients forget about the follow-through? Dr. Mahzarin Jinwala and other cardiologists at University Hospital are getting to the heart of the matter. Dr. Jinwala is the Medical Director of Heart Failure at University Hospitals and joins us today in the UH Broadcast Center. So, welcome to the show today. You found that lack of follow-through has to do more with the mind than with the heart. So tell us what that means.
So first and foremost, thank you very much for having me over. It's a real pleasure to be here, as always. I wanted to talk a little bit about some of the new stuff that we've been doing at UH as far as our heart failure goes. As you know, heart failure is a major problem in the United States and worldwide. There are over 1 million hospitalizations for heart failure annually in the United States.
Wow.
And out of these patients who are hospitalized, 25% get rehospitalized within a month, and over 60% within a year. So clearly very important. And we've been trying to devise ways to help these patients live better, have better follow-through, and have reduced rehospitalizations. And what we found that, there were several patients who, in spite of providing them with the tools, we still saw problems with follow-through. For example, a lot of these patients were on a bunch of different medications. So compliance, understanding these medications. So that's when we thought about working with our geriatrics colleagues and collaborating with them to try and identify another issue that could be contributing to these patients, which is cognitive dysfunction.
Okay, so how do you do that?
So there are different ways to screen for cognitive dysfunction in these patients. We use a very simple tool. It's called the MiniCog. It takes less than 3 minutes to do. It has two parts. The first part involves drawing a clock and then adding the numbers appropriately on the face of the clock. And then the second part involves drawing in the hands at 10 minutes past 11. And the second part is a 3-word recall where, we give the patients 3 words and we have them give us back these words in about, in a short time. A score of less than 3 means that they have some degree of cognitive dysfunction. So what we found is that amongst our patients who were hospitalized over the age of 65, there were over 40% of these patients who did not do well and who had a score of less than 3. Paradoxically, these patients were the ones who were on a much larger number of medications compared to patients who did not have cognitive dysfunction. And of course, they were more likely to be rehospitalized, especially the women.
Okay, so then after that, how do the geriatricians come into play?
So the geriatricians, it's been great to collaborate with them. What they do is that they see all our patients who have a score of less than 3, so who have some cognitive dysfunction, and they essentially evaluate for any reversible causes of cognitive dysfunction. So these could include polypharmacy, where patients are on different medications, such as medications to help them sleep, pain medications, or some medications for depression. They can contribute, and of course there are drug interactions, so they help evaluate these patients. And as well as the other thing is to look for causes of delirium, because delirium can also contribute to cognitive dysfunction. So for example, treating certain medical conditions such as acute infections can help. So they also have been following with these patients on an outpatient basis. So again, having the inpatient as well as the outpatient contribution.
Wow. Sounds like you found the missing link there.
Yes, so it's been incredible because it's been a real eye-opener for some of the families. When they saw the clocks that some of their family members were drawing, it came really as a big surprise. But it really opened the door to more conversations, more education for us, and we were aware that we had to include the family in a lot of teaching, going over medications.
Sure, yeah.
As well as for the family, they knew that they had to be more involved with the patient's health and care at home. And then also for some families, they were able to understand that the patient's needs were more than the family could provide. So again, I think
get some more help.
Been really helpful. Yeah.
That's great. That's great.
So
Heart failure cardiologists working with geriatricians. This team approach allows patients to be the winners with better post-heart issue progress. My thanks to Dr. Jinwala for teaming up with us today to tell us about it. Thanks.
Thank you.
Learn more by calling the Center for Lifelong Health at University Hospitals at 1-844-312-LIFE. That's 5433. Or visit their website, www.uhhospitals.org/lifelonghealth.